Hello, this is Dr. Peter Swanz with Vital Force Naturopathy and drswanz.com. And today is Wednesday, April 1st, and I am at home. It's just past 3 in the afternoon, and I just jumped in my sauna where it is a toasty 118 degrees, and I'm going to get a nice sweat on this afternoon and rest and relax. We are currently living in a very surreal time in not just the United States, but in the world. We are dealing with this Covid-19 infection. And, it's, I'm probably as concerned as the rest of the population is, because there's so much we do not yet know about how this virus, how this pandemic is going to play out. There's hope to be able to create a vaccine. That if that happens, it will not happen within a year. It could easily be a year or more before there's a viable vaccine that could be a way to help protect people from developing this virus and the related sequelae. So I think it's a really important thing to acknowledge that we don't have any surefire ways of avoiding this other than the social distancing, the spacing, the precautions that everyone is taking right now. So I think that's a really important thing that we're doing, and hopefully it's working and we're protecting our fellow humans, and that's a really good thing to do. Now, what my concern is that if most of us are doing the social distancing, not getting exposed to this virus, and this infection curve starts to taper off, right? We flatten the curve like everyone's talking about. There's the very real chance it may make a resurgence again sometime in the fall, winter, or late winter next year. And it may become a situation where we're pretty much having to repeat exactly what we're doing now. And with that in mind, I think now is as important a time as ever to really consider what we can do then to protect ourselves in the future from this virus. Not just protect ourselves now, but for the long term. Because what we have seen consistently with this infection is that the people who do the worst when getting exposed, infected, and then developing the pathology, the sequelae with it, are the people who are already immune compromised, who have a struggling immune system, who are having a hard time fighting it off. People that have a strong immune system, in general, mostly the younger people, they tend to get the infection sometimes completely asymptomatic and recover very quickly. So what that means is now's as good a time as any to start thinking about what you can do to improve your health holistically, to tonify your body's immune system, to address the underlying concerns, maybe the underlying pathologies that you've already been fighting for who knows how long, whether it's high blood pressure, cholesterol, obesity, diabetes, autoimmune conditions, osteoarthritis. I mean, there's so many things that we typically deal with in the United States, and now more than ever is an important time to consider making some changes to do that. So, my approach in my practice is to help patients holistically improve their health. And even though we cannot and should not be meeting in person at this time, I want everyone to know that I'm still working with patients online, and I recognize how important this is. And what I would like to do is offer a special for the entire month of April, $149. I will do my naturopathic nutritional consultation with an individual, a family member. We will talk about stress management, optimizing sleep, diet and lifestyle, exercise, basic supplementation, all of these things that we can do to help and improve our health, so that next year, if this becomes another issue, if there becomes a resurgence of this virus in the population, we're hopefully going to be in a better state to deal with it. It's very likely that, we'll be back in another quarantine situation, and I don't know if things will ever be the same after this, but I do want to be able to help as many people as I can. I feel fortunate to get to practice medicine the way that I do, and this isn't a hopeless situation. There are things we can do. We can be empowered to make changes, and right now, we're all kind of stuck at home. Let's get together. Let's get online. Let's have a Skype appointment, a phone appointment. Let's talk about your diet. Let's talk about your exercise. Let's talk about your sleep. We can spend about an hour to an hour and a half during that time. It's $149. That's a $50 discount off of that regular cost of what I do for these appointments. In addition, I will also, as a bonus for anybody in April, throw in my homeopathic viral immune support formula, which is just something you can take to help tonify the immune system. The FDA has come out and said nobody's allowed to make any claims about supplements or vitamins and how they might help or prevent the COVID infection, right? They only want it to be pharmaceuticals and or vaccines. But we know in New York City, they're already using IV vitamin C for the severe cases in the emergency room. And there's a ton that can be done with nutrients, vitamins, minerals, herbs to strengthen the immune system, to tonify the immune system so that if something does develop, it's less likely to become severe. So that's the message I wanted to share with everybody. I am getting way too hot in here right now. I'm starting to sweat all over myself. So I'm going to thank you all for watching. I want everyone to stay safe, stay healthy. You can visit me online at Dr. Swanz, SWANZ.com/connect. Reach out to me through my website. Let me know if this is something you're interested in, and we will make it happen. So thanks so much for watching, everybody. Peace, love, health always. Take care.